Lesson 1, History. Most primitive societies practiced some form of reflexology. Tomb paintings from 2500 BC show ancient physicians massaging the feet of their patients. The ancient Chinese Taoists also record the use of acupressure points on the feet to cure disease. In 1890, Sir Henry Head, a London MD, found that certain areas of hypersensitive skin were associated with diseased organs. He published his discoveries about the correspondence between spinal segments, skin sensitivity, and internal organs.
The bladder can be excited into action by stimulating the soles of the feet.
In Germany, in the early 1900s, Dr. Alphonse Cornelius developed a technique called reflex massage. By trying to cure his own disease, he discovered that by applying pressure to sensitive areas of his body, that his health improved and his pain became less and eventually disappeared. In the U.S., Dr. Fitzgerald, head of the Ear, Nose, and Throat Unit at St. Francis Hospital in Connecticut, and his friend Dr. Bowers, were making similar discoveries about the use of these reflex points. In 1917, they published a book called Zone Therapy. This book shows that each part of the body that has a reflex relationship lies within 10 longitudinal channels or zones. Later, Eunice Ingham combined zone therapy with compression massage on the feet and published a book in 1938 which developed the prototype for modern reflexology. No one is really sure how reflexology works. We do know that there are thousands of nerves in the feet and that this may have something to do with its effectiveness. Traditionally, reflexology's benefits are thought to occur through the clearing of energy lines and increasing blood and lymph flow to the reflex area. The important thing is not how reflexology works, but that it does. Reflexology is a great way to help someone heal without being invasive. The client can be clothed and the work can be done in a chair, on the couch, or on a massage table. In this video, we'll show the work on a massage table. If you don't have a massage table, an easy alternative is for the receiver to lay on the bed with their feet off the edge. Position yourself in a chair next to their feet. Traditionally, reflexologists have their clients laying in a comfortable recliner chair with the reflexologist in another chair near their feet. The key is that both the receiver and the giver be comfortable. The idea that the giver be comfortable is important. Being comfortable means not leaning forward and putting a strain on your back, not pushing so deep that your thumbs hurt, and not hunching your shoulders up around your ears. If reflexology is not easy and comfortable to give, you are not going to want to spend very much time doing the work, and you may be surprised to realize that the receiver will be able to feel if you are stressed. It will be transmitted in the way that you touch. In terms of technique, there are only two guidelines to remember. The first is that you don't hurt yourself. This means keeping the pressure appropriate and pushing more with the tip of your thumb than the pad. The second is that you make your work rhythmic and slow. This will activate the receiver's parasympathetic nervous system and will put them into a deep state of relaxation. Before we go on to the next lesson, here's a short quiz. What country has tomb paintings of ancient reflexologists? A. China, B. India, C. Greece, D. Egypt. The correct answer is D. Egypt. Who developed the prototype for modern reflexology? A. Dr. Alphonse Cornelius, B. Eunice Ingham, C. Dr. Fitzgerald, D. Dr. Bowers. The correct answer is B. Eunice Ingham. Now let's learn some techniques. This is just one of the lessons from our DVD, Reflexology for the Feet and Hands. The DVD includes 8 lessons covering everything you need to get you started practicing this great technique.